Ghana immunization coverage over the past 5 years have been very good and commendable. Since 2016 to 2020, we've been having, if you use Pentac 3 as a proxy, we are always above 99% until 2020, where because of COVID, it's 96.4%. So if you look at this, then I can tell you Ghana is doing very well. Ghana has a very robust expanded program on immunization, EPI, which we've been doing for years. And I'm happy to also tell you that since 2003, we have not had any measles-related deaths. It tells you how well we are doing in our immunization program. Over the years, Ghana qualifies for the Gavi program, which means that Gavi supports part of our immunization commodities and also deployment. The government also supports the other. But from 2027, we'll be out of the Gavi project. So we are preparing towards that.
Domestic funding for immunization remains limited, stemming from inadequate budgetary allocation. The constraints seen in the funding are evident by the failure of the government of Ghana to meet its Gavi commitment of co-financing vaccine or immunization in 2016 and 2018. Nevertheless, the government of Ghana is expected to fully finance vaccines in 2027.
Ghana's exit from Gavi may be sooner than later when, as a country, we will be procuring vaccines without donor support. The time has come for government to identify and establish a sustained domestic source of funds to finance the procurement of vaccine and related logistics for immunization.
Within the government health budget, immunization is funded from the goods and service line item. Funding to this item has been reducing since 2017. Indeed, in 2017, it was 37.1% of the total health budget, and this has reduced to 26.6% in 2019. This demonstrates the inadequacy of the government commitment to the budget line item from which immunization-related activities are funded.
The goods and services budget line item must be increased to cater for vaccines and immunization. This must be funded from an identifiable and sustainable source such as a levy or oil revenue rather than IGF generated by health facilities.
Government has limited funds due to its inability to raise enough domestic revenue. This restricts the availability of funds for the health sector as other government priorities such as education and agriculture are competing for the same limited funds. Contrary to the Abuja Declaration, which requires that government allocate 15% of total revenue to the health sector, health expenditure as percentage of national revenue hovered around 8.5% between 2018 and 2021.
Government must increase its domestic revenue mobilization by broadening the tax net and blocking all financial leakages so that the health sector can be allocated 15% of the total revenue per the Abuja Declaration. By so doing, more funding could be released for the procurement of vaccines and immunization-related logistics.
Often, fiscal projects are able to attract political points compared with services. This implies that there is limited political gain for for the government in increasing financing for immunization. Communities, and therefore voters, are more aware of fiscal interventions, for example, the building of health infrastructure, rather than non-fiscal interventions like the strengthening of primary health care services and a better availability of immunization programs.
Communities, especially parents, need to understand the financial implications of vaccine-preventable diseases on their productivity so that they would demand increased funding for immunization services to ensure that every child is reached.
Government's inability to allocate enough domestic funding for vaccines may affect vaccine procurement after 2026, and this would result in the resurfacing of vaccine-preventable diseases such as polio and rubella. Considering resources required to control these outbreaks, it would be very costly for the country if this should happen.
The earlier government begins to improve revenue generation from domestic sources, the more funds we will have to adequately purchase vaccines and immunization-related logistics from 2027 without donor support. This will then be in consonance with the Ghana Beyond Aid agenda.
Immunization-related challenges at the district level comprise the absence of cold chain within close proximity of health facilities, motorbikes, and vehicles to travel to far-reaching communities, among others. And this must be addressed. Every cedi spent on immunization yields a return of 41 times the cost. Immunization funding is therefore not a cost, but an investment in our country's future.
Health workers need immunization logistics, such as cold chain to keep the vaccines in good condition, motorbikes and vehicles to travel to far-reaching areas, tally books to keep accurate data, and shelter at outreach points for child welfare clinics. Funding is required to address these challenges and ensure that every child everywhere is immunized.
Yes, I'm in support of that call because I'm a health professional and I'm the presidential advisor on health. So anything which will bring in money or resources into the health system for it to work and work well, because we want to give quality care to the people of this country. And we are all working towards universal health coverage by the year 2030. And we have to get funds to support health. We haven't reached the Abuja Declaration yet, and we have to work towards Abuja Declaration so that we get at least 15% of the budgetary allocation for health.
Fellow Ghanaians, let us join hands in advocating for a sustainable annual financing
for immunization in the government of Ghana national budget.